So, how do you outsmart a virus? I mean, really outsmart it. Not just fight it head-on, but actually sabotage it from the inside out. Today, we're going to talk about Tenofovir, this pretty remarkable drug that does exactly that. It literally throws a wrench in the assembly line of some of the world's most persistent viruses.
You know, a virus is basically just a tiny, tiny replication machine. Its one and only goal, make more of itself. So if you want to stop it, what do? Well, you've got to sabotage that assembly line, right? That's the big question we're diving into, and it turns out a drug called Tenofovir, well, it's a pretty fascinating answer.
Okay, so let's get into it. We're talking about a real cornerstone of modern antiviral medicine here. I mean, this isn't just another pill in a bottle. It's a foundational tool that has genuinely changed the lives of millions, and I mean millions, of people all over the world.
So what exactly is this stuff? Tenofovir is what's called an antiretroviral medication. It belongs to a class of drugs called, get ready for it, Nucleotide Reverse Transcriptase Inhibitors, or NRTIs for short. Yeah, I know, that's a total mouthful. But don't worry about it, because that name, reverse transcriptase inhibitor, that's the key. That's where its secret weapon is hidden.
And its main targets? They're two of the big ones, major global health challenges. We're talking about HIV, the virus that causes AIDS, and Hepatitis B, which can cause some really severe liver damage. For both of these viruses, Tenofovir has been an absolute game changer.
Okay, so how does this sabotage actually work? This is the really cool part. Tenofovir's whole strategy is to become something called a chain terminator. And trust me, it's a brilliant way to break a virus's most fundamental, most important process.
The whole thing is basically a clever three-step deception. First, the drug gets inside our cells and gets activated. Then, step 2, it puts on a disguise. It makes itself look exactly like one of the natural building blocks. Think of it like a Lego brick that the virus needs to build its DNA. So the virus's little construction worker, this enzyme called reverse transcriptase, comes along, sees this fake Lego and says, hey, I need that. It grabs it and tries to snap it onto the chain it's building. But here's the trick. It's a dud. It's a dead-end piece. It grinds the entire assembly line to a dead stop. And just like that, no more viral DNA, no more new viruses.
It's a true molecular saboteur. I mean, it slips this dead-end piece into the works and just, boom. The DNA chain is terminated way too early. It's such an elegant and just incredibly effective way to stop a virus dead in its tracks.
But you know, the story doesn't end there. Because like with any great invention, the first version, well, it worked, but it wasn't perfect. Not by a long shot. So let's talk about that original formula. It was called TDF. So, TDF stands for tenofovir disoproxyl fumarate. This was the big breakthrough, right? It was designed specifically to get the drug where it needed to be. But there was a catch, and it was a big one. To get enough of the good stuff, the active drug, inside the cells that really mattered, you had to flood the whole body with it.
And when I say flood the body, I mean it. A typical daily dose was 300 milligrams. Now, I want you to lock that number in your head, 300 milligrams, because it's going to be really important in just a minute. The problem with that huge dose is that you ended up with a lot of the drug just floating around in your bloodstream. And yeah, it was fighting the virus, but all that extra exposure was causing some serious collateral damage. It was especially tough on two parts of the body, the kidneys and the bones. This meant there was a higher risk of kidney damage, and it could also lead to a loss of bone density over time. So, sure, it was an effective drug, but it definitely came with a pretty significant cost. And this is where the science gets really, really cool. The challenge was obvious, right? How do you keep all that virus-stopping power, but get rid of the collateral damage? Well, the answer was a major upgrade, a much smarter, much more targeted version of the drug, called TAF. TAF, or tenofovir alafenamide, is just a brilliant piece of chemical engineering. Here's why. It's way more stable in your blood. That means it doesn't just activate anywhere, it waits. It doesn't release the active drug until it gets inside the target cells, you know, the exact place where HIV and hepatitis B are trying to replicate. Think of it like a smart bomb, or a special delivery package that only opens up once it arrives at the perfect address.
And because it's so much more efficient at hitting its target, the dose is, well, it's dramatically lower. Remember that 300 milligram number I told you to keep in your head for TDF? Well, with TAF, the typical dose is just 25 milligrams. 25! That is a staggering reduction. It means over 90% less of the drug is just floating around in your body. It's a massive, massive improvement. Looking at them side by side really tells the whole story. The daily dose goes from 300 down to 25. The drug levels in the blood go from high to very low. And what's the result of that? Well, the risk to your kidneys and bones is significantly lower. It's pretty clear why, in most situations today, TAF is absolutely the preferred choice.
Now, of course, no drug is perfect, right? There's always a trade-off. And while TAF did an amazing job solving those big kidney and bone problems, it has been linked to some other, less favorable changes, particularly in blood lipids, things like cholesterol. So it's not that it's side effect free, it just has a different side effect profile. And for most patients, it's a much, much safer one.
Okay, so we've got this powerful, highly refined tool. What does the modern playbook for actually using tenofovir look like? Because it's about way more than just taking a pill every day. It involves a really careful strategy and a lot of monitoring.
Basically, tenofovir gets used in three main ways. First, for HIV treatment, where it's a total backbone of the combination therapies that people use. Second, for HIV prevention, you might have heard of this, it's called PrEP, and it's incredibly effective. And third, for treating chronic hepatitis B, where it's a first-line therapy to suppress the virus and, really importantly, protect the liver. And because this drug is so potent, patient safety is it's everything. That means regular checkups, especially to monitor kidney function. It also means you've got to be really mindful of drug interactions. I'm talking about simple, everyday things like antacids or even mineral supplements. They can actually interfere with how the drug gets absorbed, so you have to be careful to take them hours apart.
And this brings us to what is maybe the single most important warnings, so please listen closely. For patients taking this for hepatitis B, you cannot just stop taking it. Stopping abruptly can cause the virus to just roar back to life, and that can lead to a severe, sometimes even fatal flare-up of liver inflammation. This is exactly why this therapy has to be managed by a doctor. No exceptions.
You know, when you look at the jump from TDF to TAF, it's just a perfect story of what scientific progress looks like. It's about taking a good drug and making it a great drug, simply by making it safer and way more targeted. And that's how medicine moves forward. We constantly refine our tools to fight these diseases better and better. So it really leaves you with a final exciting question, doesn't it? What's the next big leap in antiviral treatment going to look like?